This is Urban Health Today, and I'm speaking with Dr. Alessandra Maleddu, medical oncologist and sarcoma specialist at the University of Colorado. She's here to discuss desmoid tumors, aggressive and debilitating invasive soft tissue tumors that are often misunderstood, and ways to improve the often complex patient diagnosis journeys. Thanks for being here today, Dr. Maleddu.
Thank you for having me. This is great.
It's wonderful having you to talk about this. Let's get started. Please talk about your background and your work as a sarcoma specialist.
Okay, perfect. Thank you. As you said, I am a medical oncologist and I specialize in treating patients with cancers of the bone and the soft tissue. These are also known as sarcomas, and they're a very rare type of cancer. I trained both in Italy and in the UK, and during my last fellowship at the University College London, I was able to work with an amazing attending, and she had started a virtual clinic which was focused only on patients with desmoid tumors. So after I left that position, I didn't really feel like leaving patients, so I'm still here focusing on patients with desmoids.
Okay, so what exactly are desmoid tumors and how do they differ from other soft tissue tumors in terms of growth and behavior?
Okay, so desmoid tumors are a rare, locally aggressive, but non-metastasizing tumor of the connective tissue. Um, they can occur anywhere in the body, in the arms, legs, chest wall, abdominal wall, in the neck, and sometimes inside the abdomen. What makes them different is that, as I said, they don't have the capability of metastasize, which means they cannot travel to other districts of the body from when they originate from. However, even if they cannot travel, they can be locally aggressive, which means they have a pattern of growth that can cause local damage, which translates into pain clinically, deformity, sometimes lack of function. And this is due, as I said, to their infiltrative growth of pattern. And when you can see that they are able to grow into the fascial planes in the muscles.
You know, I had a young lady about maybe a year or so ago who she was a nurse, but she was also a desmoid tumor sufferer. And she developed her desmoid tumors after having a cesarean section, giving birth to her child.
Yeah, so that is very interesting. So you touched multiple very, very important topics. So there is evidence that desmoid tumors can arise following a trauma or a surgery. Many patients have a past medical history, as I said, of a car accident or a previous surgery or maybe a drain that was in place for a long time. Other patients are also have a history of previous pregnancies and C-sections. So as we know, the most common patient is a young female. The median age of diagnosis is 36, and female patients are 2 to 3 times more likely to be diagnosed with desmoids. So there is certainly a linkage in between pregnancies and trauma.
So why are desmoid tumors so often misdiagnosed, and what are some of the common conditions they get mistaken for?
They are often misdiagnosed. So to explain this, we have to look at the rarity. It is important that we know that every year in the US, we only have a number of 1,000 to 1,600 new cases of desmoids. So you can understand how rare they are and how probably the average physician out there in the community may see a couple of desmoids in their lifetime, in their career. So that's one of the things that make the diagnosis challenging. The other aspect is that desmoid tumors, they have features that can mimic benign conditions like lipomas or more aggressive conditions like GIST or leiomyosarcoma. So I think the key is just to be seen by a sarcoma specialist.
Hmm. Desmoid tumors can be particularly debilitating. Could you share some of the physical and emotional impacts patients experience when living with this diagnosis?
Yes, for sure. So yes, desmoid tumors are really can be really debilitating, and to understand why, we have to look at two principal features of these tumors. One is how they grow. So as I said, they can be locally aggressive, and they very often can arise in your limbs or chest wall or abdominal wall. So if they, given their pattern of growth, the invasion of normal tissue, they can cause deformity and they can cause significant loss of mobility. So these put together with the age of patients, which are all very young and normally in the peak of their career, you can understand how physically and emotionally stressful this condition can be, and also how can impact their not just their physical health, but also their financial health.
Are there any known hormonal or genetic factors at play?
So yeah, the rationale of you are asking that because for several years, hormonal treatment has been used to treat patients with desmoid tumors. This is not common practice anymore, but we do know that the rationale for using an anti-hormonal drug that has been based on several clinical observation mostly. So we see a higher incidence in female patients during and after pregnancy, and there are also several clinical reports of spontaneous regression during menopause, and also using hormonal agent support. There is an hypothesis that estrogen have a role in the growth and maintenance of this disease. However, a real advantage of hormonal treatment has not been proven, and it's certainly a very, very interesting topic of future research.
So what does the typical diagnostic process look like, and how can physicians help reduce the high rates of misdiagnosis?
So the typical diagnostic process should look like this. Any patient that has a new lump and bump or a new pain should first undergo imaging. Ideally, you will start with an ultrasound, and if available, you can proceed with an MRI. So these techniques are imaging techniques, and they only reveal the presence of a desmoid. What is really diagnostic is a tissue biopsy, which means the patient should undergo a tissue biopsy in a physician office. So the physician will take a little sample of the tissue and ideally have it reviewed at the Bone and Soft Tissue Sarcoma Center. Only like this we can get to a certain diagnosis and a correct management.
So, do you ever get them growing under the skin? Because don't if they get mistaken at times for a lipoma typically grows underneath the skin. So it's not necessarily something you can see. Please correct me because you're the medical oncologist. How do they get mistaken for lipomas?
They get mistaken for lipomas because, so let's just say the patient sees a new or pre-existing lump, just a mass that is growing. On imaging, it's very, very challenging to understand what they are. So many patients, but because they don't have clear malignant features on ultrasound or MRIs, so they get labeled as lipomas without a biopsy. Typically, a wrong diagnosis is caused by an incomplete workup.
So how will a clinician know to forward a patient on to a medical oncologist or a sarcoma specialist in that case?
In that case, when it's, as I said, that when it's mistaken for a lipoma, in general, those are patients that didn't have a tissue biopsy. In general, it's always appropriate to refer to a sarcoma center or at least to a specialist orthopedic clinic, a patient with a soft tissue mass. And a specialist center will always perform a biopsy before acting on any treatment.
So you're suggesting that in general, if a patient presents with a soft tissue mass, they should just be referred to a sarcoma specialist just to out of an abundance of caution?
Yes, I think it's appropriate to be evaluated by a specialist team, like an orthopedic teams or a sarcoma center if available. An alternative would be to proceed with a biopsy in the community. But tissue biopsy is the only possible way to diagnose the desmoid tumor.
Okay. You mentioned newly updated resources for patients, including discussion guides, and care option guides. Can you talk a little about these resources and how they can empower patients and improve their overall care journey?
Yes, for sure. So, as I said, they're very rare,
Mm.
and they cause emotional distress. One of the causes of the emotional distress is many times it's isolation. Patients feel like they're the only one to be diagnosed with desmoid tumors. They typically don't know anyone else. And as we said, because they're difficult to diagnose, their journey from first symptoms to diagnosis can be long and difficult. So I think these resources, these new resources, desmoid tumors, it's really helpful because not only displays information for the patient, but also gives access to other patient history. So there are interviews with patients that they share their diagnostic journey and treatment journey, and I find that very helpful.
Given the rarity of desmoid tumors, what advice would you give to both patients and clinicians who suspect they might be dealing with this condition?
So I think the best advice is to be seen at the sarcoma center. They don't, depending on where they live, if they are from a rural area, I understand it may be challenging to see their sarcoma specialist more than once per year. But I think at least at the beginning of their journey, they should be adequate counseling by a sarcoma doctor.
Dr. Maleddu, thank you so much for your time today, and thank you for sharing your knowledge with us about this very rare condition. I really appreciate having you today.
Thank you so much.